As I stated in the introduction, our system is very much based on a market system, and it assumes that healthcare is based on a market system. The problem is that you have to have some assumptions that would make a market system work. And one of those assumptions is that individuals are rational, so they know what goods and services they're going to need and that are going to make them best off. So that's one assumption, and that they can use all this information, and it's got availability in a really understandable, low cost. You don't have to pay a lot of money for it, and you can get it really accessible. That's one assumption. B, that we know what we need when we need it, why we need it. Again, that we're not going to be influenced by anybody else, like a doctor telling us we need something, or advertisements for drugs or anything like that. Again, not really happening in our system. See that the wealth is, and what the society cares about, is distributed amongst the society's values. So if we all value health, that's where we'll put the money, and we'll make sure that everybody has it, as opposed to it's distributed based on who has access to resources and income, which is our health system. Now, the government could intervene in these marketplaces, but they're trying to perfect those imperfections, so regulate things that are unsafe, come up with policies that try to address some of the bad parts of the market system. The problem is that sometimes this is not so good, right? We have stuff that sort of keeps ahead of it. So sort of like, making sure that direct advertisement to consumers for drugs. Well, we let that happen, but is that a good thing? Should the government say no? We are the only country that still does that, by the way. And what that does is it creates a need for new drugs. Whether you need them or not, you've seen them advertised. The problem is that governments, in and of themselves, are beholden to a lot of different actors. So for instance, they may or may not have the expertise. Very few people who are doctors get elected into any state, federal, or local levels of politics. They're too busy treating patients. They might be beholden to specific people who vote for them, or people who fund them, special interests like the insurance company or big pharma. That is not the people who get impacted the most by healthcare, correct? Health policy would impact your health and your health outcomes. If you don't vote and you don't belong to big pharma, then you're not going to have as big an influence on what policies the government comes up with. And that's a problem. In the absence of these, you're going to have to see that government might be very inefficient in how it delivers healthcare and how it can deliver healthcare. Consumers have some problems too, right? It's not just government. One is they cannot use the information effectively to make the best choices, right? So they can't decide when they should obtain care, how they should obtain care. They can't see the cost of it before it happens, right? And decide who they're going to go to, especially since you don't know when you're going to be sick sometimes. You also don't know what you need because you're not sick yet, so you might not put the money into preventive health. Sometimes preventive health stuff like a healthy diet, lifestyle, being active, those payoffs aren't right away, but they're when you're 40 or 50, but you're putting in the time now, so the positives come much later after all the negatives, getting up early and running and eating healthy food when you really want a donut. So that sort of time continuum goes against you being able to use rational information. Another thing is, if you have health insurance, you can't go to any doctor you want, so you have a prescribed amount of people you can go see. There's also another challenge in that you don't have sort of report cards of what's a good doctor, what's not a good doctor. You can sort of look on rating systems, but that person may have a different rating system than you do. And are those rating systems sort of independent, right? So you may not think infection rate matters or how healthy outcomes you have. You might care more about wait times, but in reality, we should look at your outcomes, right? So, and your outcomes might be different if you go somewhere where people come in sicker. So that would have to be accounted for if we did some kind of report card. But at this point, we don't really have those kinds of report cards. And your need for healthcare is always influenced and controlled by the physician. The physician determines if you're sick. They determine if you get a prescription. They determine if you get tests. So we would call that a physician-induced need or demand for healthcare, right? Not a need based on your sickness or based on genetic predisposition, but the physician determines what you get. So there's a huge gatekeeper there. And also sort of in our society, as we know, we compare to other people. So am I as healthy as them? Do I get what they get? Do I not get what they get? So that's not so rational. That's very much the demand ramped up by who's in your sort of friend group, who's in your comparison group. And there are other things that really do control your access to healthcare that is not based on you being able to be an informed consumer who knows when you're going to need to use stuff. And that's a problem, especially when you're trying to come up with health policy, right? Now you can have the demand side or the supply side. So the demand side is you want to improve the price mechanisms of stuff, or you want to look at high deductibles to make sure that consumers don't overuse. But the supply side also needs to be focused on. This is one of the reasons why policy is so hard, is you've got to do both those things at once, where you're looking at sort of who's determining who gets what medical technology. Are we going based on what is useful? Are we just going based on what people want? Are there limits on the number of physicians and hospitals and payment incentives? Is doctor paid to make you better, or are they paid no matter what? That's an incentive that determines the supply you get. Are there utilization reviews? Are they using the medicine that has the most impact, right? Or are they just using whatever the farm rep come in and told them was good? There's different ways to look at this, and it's the supply and the demand side that you have to look at both at the same time when you're trying to come up with a health policy. Now, there are other reasons, right? There are things we can learn from different countries. Different countries have different health systems, but that is also based on the history of their health system and cultural differences, okay? So it's not just a market system. Culture does play a big part in that. And it is really hard to look at how different countries regulate things and compare it to our policies, because we have such a different form of government. There are lots of different places to impact it, which is good news when you want to make different health policies, but bad news if you want uniform health for everybody. And also, there's really not a lot of ways to measure outcomes yet. There's some good measures, but we need to have better measures in place so that we can actually look at, once policy is implemented, what's the outcome and how can we improve it? So those are all sort of constraints or things you have to think about when you're looking at health policy and the health system.